Several thousand healthcare workers have died across the United States. Tens of thousands have become disabled. Will a vaccine come in time to save them? Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. And welcome back. Alan in Seattle, you are on the air with Congressman Pocan.
Good morning, Congressman. Looking past the current Congress, in hopes we'll get a better one. I am concerned about our heroes on the front line, the doctors, nurses, and anybody else working in healthcare, with the unprecedented number of deaths. These people are going to need support about the June, when they can finally catch a breath. They are mentally exhausted, physically exhausted, emotionally exhausted. They're the last people that these dying populations see. Can we put some help in there? They're going to need long-term psychiatric care.
Alan, you're completely right that people are exhausted here in the healthcare profession. I'm hearing this more and more, and fortunately, with the vaccines coming out, I heard the terminology today. The beginning of the end is happening, and that's good. The end of the coronavirus, if we can get the vaccines out and distributed, and make sure they're given out as a priority to those healthcare workers you just mentioned. But when I talk to people who are working in this field, they are so stressed. And they're so worried, and that's why in states like Wisconsin, where we've had, unfortunately, way more cases than we should as a percent of our population in the country, we're nervous because if someone gets exposed, they have to be quarantined. Others are getting sick. Suddenly, you've got real strains on the system, our hospitals, our clinics, etc. So we need to do more. That's part of what we had in the bill that the House passed, was more protections for those frontline workers, but we can't get that right now through Mitch McConnell. So you brought up, I think, one of the most important points right now, and that's why everyone has to be as selfless as possible, even at the holidays. We have to make sure that we're not getting sick, because we can't stress those workers and those systems anymore. And, it's for a short time longer. The vaccine's there, but you brought up a perfect point. A lot of people stayed home on Thanksgiving. We're going to need to do that, keep immediate family functions for the other holidays coming up.